Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attends every month, believe it or not, so it's a monthly appointment they have, and as you can see in the distance they've got a T-tube, grommet, a ventilation tube, and I'll explain what that is in a bit more detail in a moment. The reason why the patient has to attend on a monthly basis is that they also, in addition to that T-tube, they suffer from otitis externa. So otitis externa is an umbrella term given for an infection and or inflammation of the outer ear. And they also suffer from that. So I'm going to just discuss the otitis externa first, and then I'll go on to the T-tube and explain why in combination it's a bit problematic for the patient. So they have this really dry skin that develops every month, and not only does it line the ear canal, but it is also adhered to the eardrum, and it makes the patient's ear extremely itchy. Now, when you've got otitis externa, the key bits is to avoid water entering the ear, which they already do because of their grommet, and I'll come back to that in a moment. But there is also medication that can be prescribed to help with all this dry skin. It's not bulletproof. Some patients who suffer from otitis externa, it's just a chronic condition, and despite all the treatments that they have, all the prescribed medication, it really doesn't do much. But with this patient, we don't know whether it will help or not. And the reason for that is that the patient can't use these normal drops and sprays that are given for otitis externa because of their T-tube. So the T-tube is a ventilation tube, and it allows air to enter into the middle ear cavity, which is the cavity behind the eardrum. We want the middle ear cavity to be full of air, and the air pressure behind the eardrum to be equivalent, the same as the air pressure in the atmosphere. Now, typically, air enters the middle ear via the back of the nose. There's a little tube at the back of the nose called the eustachian tube, which connects directly to the middle ear, and that's where that's also known as the pressure equalizer in the ear, the eustachian tube. But in this patient, their eustachian tube is completely blocked, so air can't enter the middle ear via the back of the nose. And the cause of that is that it's been most of their lifetime. So the ENT doctor feels it's due to just anatomical and narrow eustachian tube. The resulting cause of a blocked eustachian tube is that there's no air behind the eardrum, and that creates a vacuum effect. And the vacuum effect causes the eardrum to be sucked inwards, a bit like when you're on an aeroplane, which can cause earache, tinnitus, vertigo, hearing loss, and it's become an issue for the patient over the years. And so they had grommets fitted. Now, I'll come back to that moment. You can just see here, I'm just delicately trying to peel this skin directly off the eardrum. It's crusted. Now, when we peel this off, we've got to be careful that we don't dislodge that grommet, because this skin can grow around the grommet. So when you're peeling skin off the eardrum, sometimes it can dislodge the T-tube, and we don't want that to happen. So I'm just going from the top of the ear canal, and I'm just going to peel down towards the eardrum, and then you'll see in a moment I managed to peel this crusted skin off the patient's eardrum. Where was I? So I was talking about a grommet. So one treatment of eustachian tube dysfunction, so when you've got a vacuum effect behind the eardrum, is for an ENT's doctor and surgeon to insert a ventilation tube, and they're called grommets. So the surgeon, using a scalpel, makes an incision into the eardrum, and so in essence, they're artificially perforating your eardrum by doing that. Sometimes there's some catarrh and fluid behind the eardrum as well that they suction out, and that's because that fluid can't drain out of the eustachian tube because it's blocked. And to prevent the eardrum from healing, and thus then causing the same issue to occur again for the patient, to put a grommet in, and a grommet keeps the eardrum open. It prevents it from healing. And the typical grommets in the UK are called a Shah grommet, the little white grommets. And over a period of 6 to 12 months, they naturally fall out of the eardrum, hopefully into the ear canal, or sometimes they can fall into the middle ear cavity, but that's rare. And then that grommet eventually comes out the ear by itself. So as the skin that lines the ear canal sheds and dies, it moves sideways out of the ear like a conveyor belt, and the grommet is sat on top of that conveyor belt, and eventually, over the course of 3 to 4 months after it's fallen out, it can come out of the ear. And you're hoping that whilst the grommet's in situ in the eardrum, that whatever's wrong with the patient's eustachian tube, so if there's congestion or inflammation there, that it resolves, and by the time the grommet's fallen out, the eustachian tube's functioning again, and it can equalise the air pressure and it can allow fluid to drain. However, with some patients, the eustachian tube is permanently blocked. It's never really going to unblock itself. So this patient originally had a normal grommet and it fell out, and whilst they had the grommet, they're over the moon, it was really helping them. And after the grommet fell out, after a few months afterwards, the eardrum healed itself. So the grommet is no longer there to keep the eardrum open. So the surgeon decided to insert a T-tube. Now a T-tube is, again, a grommet, but it's known more as a permanent fitting grommet, so it's meant to be there for many, many years as opposed to the standard grommets. And you tend to find T-tubes more in adults. With children with standard grommets, we're hoping as the child gets older, and the children are always prone to getting bugs and allergies, and they're always suffering from nasal congestion. And in children, the eustachian tube is much narrower than in adults, and the plane of the eustachian tube is more horizontal. And as they get older, the eustachian tube becomes more vertical in position, and gravity can then help drain any fluid from the eustachian tube. So many children have grommets, and they over the years they grow out of the need to having grommets because the eustachian tube is wider and it's more vertical. By the time you reach adulthood, that eustachian tube is not going to get any larger, and it's not going to change in position. It's not going to become vertical. It's already at its optimal position and size. And if, as an adult, you're still suffering from a blocked eustachian tube and it's not due to inflammation or congestion, that sometimes can be treated with nasal decongestion sprays, but it's more anatomical, or the muscles either side of the eustachian tube that contract, which then causes the eustachian tube to open to equalise the air pressure and allow fluid to drain. If those muscles have become weak, the only really other solution, well, there's two other solutions. You can have eustachian tube balloon dilation. It's a procedure performed by an ENT surgeon. They insert a balloon up the eustachian tube via the nose, and they inflate the balloon using saline solution for, I think, up to 2 minutes, I believe. And that's designed to try and widen the eustachian tube. There's no guarantees it will work, but that is one known treatment. And also the balloon itself, it will as it's inflated, it will compress against some cells that are lining the eustachian tube, which are slightly inflamed, and you're hoping that the balloon kind of almost kills those cells, and when it reheals, you don't get that inflammation. But another approach is to put a permanent T-tube in there, like what's happening with this patient. Now, that's really helped the patient in terms of their hearing. They're not suffering from a blocked eustachian tube and the symptoms, as I described earlier, that can arise if you've got a blocked eustachian tube. But the problem is, because they're also suffering from this otitis externa, they're very limited in any treatment. Now, treatments, as I said, for otitis externa, these antibiotic sprays, which the patient can't have because these antibiotic sprays, they're known as what we call ototoxic. If they enter the middle ear cavity via the hole created by the T-tube, it can penetrate into the inner ear and cause permanent hearing loss. And also your normal over-the-counter earwax drops like olive oil spray, which can be good for dry skin, the patient's not able to really use those, although recently the ENT surgeon said it's okay to use them once in a while. Because even olive oil or sodium bicarbonate, if you read the instructions in the packaging, it advises not to get used if you've got a hole in the eardrum. But as you can see, we've cleared all the dead skin, and the T-tube's patent, it's not blocked, and the patient feels a lot better. There is some drops that the patient can use. It's called ciprofloxacin. Ciprofloxacin was originally used as eye drops, and they were given to for infections in the ear off-label, but since they've now been developed also for ear infections. And ciprofloxacin is non-ototoxic, So they can be used if you've got a perforation. Well, I hope you enjoyed that video, guys.